Hi, it's Tom here from Running Physio. Today I'd like to talk to you about fatigue and the role that it can play in the development of injury and how we can work around it, how we can address fatigue as part of our treatment plan. Now, I'd like to set the scene initially. I'm thinking about an athlete I've seen fairly recently. She trains pretty much every day. She does regular strength work. On the surface, she's doing everything right, but actually her performance levels have really reached a plateau, and she's starting to pick up injuries and aches and pains. And when we do the tests, when you consider the amount of strength and conditioning and things she's actually doing, you'd really expect her to be scoring higher than she is on things like her control work and particularly on her strength tests. But actually she's scoring surprisingly low. And actually this type of picture is someone who's got an awful lot going on in their training, maybe a lot of life load and things going on outside their sport as well. Quite often what's influencing their results and stopping them performing as they want to is fatigue. Now, actually, what we have to recognize then is a lot of the tests we might do, particularly around strength, control, flexibility, they're actually really just snapshots in time, and they are going to be influenced by things like fatigue, by training load and things over a longer period of time. So we know then that fatigue can be an issue, and I think we're all aware of this. But actually, quite often when we're working with athletes, our first thing to do is ask them to do more. To say, let's increase your strength work, let's add more load, let's try and get you stronger, because that's often what we want to do with athletes, isn't it? Build their strength. But actually, quite often, we need to think the opposite. We may need to reduce their training load, we may need to boost recovery to address fatigue. And I've seen this myself recently. Since gyms and things have opened up, I've been trying to get into the gym, get back in shape, work off the cheese belly that I've developed over the last few months. And I was running the other day and had to stop because my hamstring was cramping up. And I had to stop, had to walk for a bit, and just about got back from that run. Now, my training load hasn't changed in terms of my running, but it has in terms of my gym work. I haven't been sleeping as well because we had lots going on. So you can see then the fatigue levels have gone up, and the solution to that hamstring cramping and pain isn't for me to go and do loads more strength work on the hamstring and add to the fatigue. The solution was focusing on recovery for a few days over the weekend. The next run I did, no hamstring issues at all, no crampiness, feeling much more fresh. And this is a difficult judgment we have to make sometimes with a patient between, do we add in more, do we build in strength, or do we actually think about taking stuff away for a little bit, particularly around our strength work. Now, there is some research linking fatigue and injury. A nice systematic review fairly recently by Vishuran et al. In 2019. Now, this review is really clever. They looked at various different studies that had done fatiguing protocols. Now, those fatiguing protocols can vary. It might be, for example, a fatiguing run, or it might be doing repeated exercises like maybe side-lying abduction to fatigue the glutes, something like that. And then looking at the acute effects that fatigue then has. So they looked to see which studies had done this and which ones had actually identified factors that were known risk factors for injury. So it's quite a clever review. And just to highlight some of their findings then, they found some evidence that acute fatigue can reduce both concentric and eccentric hamstring strength and possibly reduce hamstring flexibility as well when we're in that fatigue state. So they thought that this may then increase hamstring injury risk. And you often will see in team sports that those hamstring injuries perhaps occur towards the latter stages of a game when someone is in a fatigue state. They found with the ankle, acute fatigue led to reduced ankle joint position sense and reduced single leg postural control and stability. And they found then that this is likely to increase the risk of lateral ankle sprain. And then the level of the knee, they found acute fatigue reduced quads peak torque, and this then could increase the risk of patellofemoral pain potentially, because we know the quads are really important in patellofemoral pain and knee function in general. Now, they also comment in this review that the fatigue response is very individual, so it's really important that we recognize this and assess the individual rather than assuming we're going to see these same effects in everyone. And they also acknowledge in this review that the evidence is sparse. So in lots of areas we don't have concrete evidence telling us exactly what the effects are likely to be, and it is likely to vary between different individuals. And there are some other theories as well around fatigue, and perhaps a bit more effect specific to runners. For example, there is some evidence that fatigue can increase ITB strain rate. So we think it might be a factor in the development of iliotibial band syndrome. And it's something we talk about in our webinar series on ITB syndrome, which you can access by the link I've put in the title there. So it may be part of ITB issues. We think it's also possibly part of bone stress injuries in runners. When we have muscular fatigue, we think it increases the stress on the bone, and that can then lead to bone stress injuries. So in these conditions where we think fatigue is an issue, then particularly with things like the return to running process, we might put more walk breaks in there, and that seems to be quite effective for things like ITB syndrome, bone stress injuries, to include walk breaks more regularly in that return to run program, and then gradually phase them out. There's also been some studies that suggest our movement patterns may change under fatigue. And again, this is likely to be individual specific and speed specific, but there's a little bit of evidence that we might see an increase in hip adduction angles and rear foot eversion angles. And we've got to consider then the effects that might have in terms of tissue load. So if you're getting more hip adduction during running, you might expect again to see a little bit more ITB load, a little bit more patellofemoral joint load, possibly more loading higher up in the glutes at the level of the hip. So we want to think about the effects these may have. And there's also some evidence looking at more middle distance runners, finding that the calf may fatigue and lead to increased work at the level of the knee. So there's lots of different findings from the research. They're far from conclusive. So what I'd encourage you to do is work with the individual to see what effects fatigue has on them, on their movement patterns, on their symptoms, etc. Now, staying with fatigue, there's actually quite a nice rate of fatigue scale from Michelreiter Tools' work in 2017 that you can use with people and get them used to using, that allows them to score their fatigue levels out of 10 from not fatigued at all at 0 to total fatigue and exhaustion, nothing left in the tank, up at 10. So people can use these scales and then modify their training accordingly. It's absolutely fine to get short-term fatigue after challenging training sessions, but that sensation of fatigue should pass. If you're getting prolonged fatigue and performance impairments, that can be suggestive of overtraining syndrome. That often needs quite a multidisciplinary team approach to address that. So we need to be aware of some of the more kind of prolonged signs and symptoms to look out for. Now, for me, some of the signs that we're going to see of fatigue would be obviously subjective reporting, the patient telling you they're feeling very tired, they're feeling very heavy, they're struggling towards the end of a run. I might think that's particularly relevant for someone's pain if their pain is kicking in towards the latter stages of a run, or when they feel that they're in a fatigued state. It might be that you'll start to see an increased rate of perceived exertion for the same training sessions. So maybe the normal kind of 5K run that they would do, they're doing at their standard pace, but it's feeling like a lot more effort in that fatigued state. We might see muscle tightness and cramping like I was getting. Sometimes you see this in your tests, often with things like testing single leg bridge. That seems to be a bit of a cramper. If someone's hamstrings are fatigued, they often will get cramp in that situation. So for me, again, that's a sign that they may be in a fatigued state. You may see changes in mood, irritability and low mood can occur when we're tired and fatigued. And again, these are potentially a sign of overtraining syndrome if they're persisting. And also balancing out with what's going on in their life and their training. So quite often, if you're seeing these signs and symptoms, pain towards the end of a long run, muscle tightness and cramping, subjective reports of fatigue, they'll go hand in hand with a high volume or high intensity training schedule with little rest and recovery within it. So if we're seeing these potential signs of fatigue, we then want to try and assess it. You could use that fatigue scale we've talked about, but you could all try and assess it in terms of the effect it actually has on their running gait, for example. So get someone to run on your gait analysis when they're fresh, and then get them to come in and run for you again in a fatigue state, maybe at the point during their run that they're actually getting the pain. And look to see if there are differences, and do those differences in the running style lead to more stress on the sensitive tissue. So then perhaps you can see maybe someone with patellofemoral pain towards the end of a longer run, they're getting a bit more hip adduction, which may place more stress on the patellofemoral joint. So you could work with cues they can use in that fatigue state to reduce that hip adduction. So you can have some specific interventions to use in that fatigue state. But of course, as well, we want to manage the training load and the recovery. Make sure that there's enough recovery in their training plan. Consider taking a recovery week. If someone's coming into you in a really fatigued state, give them a chance to actually recover, and quite often then you'll see a lot of these symptoms and things improve. A lot of runners and athletes think, training, the more you do, the better it is, but actually you'll reach a point where it's diminishing returns. You do more training, you get more fatigue, you see more performance impairment, and actually sometimes they'll see boosts in their performance simply by getting more recovery, by sleeping more, by planning recovery better into their schedule, and that can really help. So it isn't always about doing more. Also, when you're working with an athlete and you're considering adding strength training into the picture, if you've got someone in a really fatigued state, lots of crampiness and things like that, you often will need a period of time for that to recover before you can bring strength work in, because otherwise all you're doing is adding more to that fatigue. In that state, if they are going to continue some strength work, I'd often modify it. So we might say, well, let's just do it once per week because that can maintain your strength, and we know there's evidence to support that. Let's stop you working shy of fatigue. So let's leave maybe between 2 and 4 reps in the tank, so you're not working yourself to fatigue within those strength training sessions. You're stopping shy of it. Let's think about using longer rest periods or lower volume strength training overall. So we can modify it so we can keep things ticking over, but actually not keep working them to fatigue and prolonging that fatigue issue. So a few things for you to think about there. If we think about the role of fatigue in the development of injury, we can see that there is some evidence that it can result in changes in strength potentially that can lead to injury, in changes in movement pattern that can lead to injury, and in perhaps changes in tissue loading that possibly could lead to injury, but that the evidence is sparse and it's likely to be individual specific. So we need to work closely with that individual, assess their fatigue levels, adjust their training and their strength work accordingly, put that focus more on recovery, particularly on sleep, but also perhaps having a look at life load and stress as well. And then when they've had a chance to recover more, we can then see if some of these tests have improved, and we can look to plan and progress them towards their goals. Okay, thank you very much everyone for listening today. I'm going to take a short break in these videos for a little while, but if there are any topics you'd like us to cover, please do let us know in the comments and replies, because these videos are for you, and we're always interested in new topics and ideas you'd like us to cover. Okay, thanks again for listening. Bye for now.